The work that I've done over the past decade of public health has really been focused around improving people's awareness of the specific issues that women experience and how that has been ignored for centuries.
Every day when I walked to that hospital, I'd see veterans that served before me or those that served with me, throughout the hospital. And remember, this is my foxhole now, this is where I'm going to do my part to serve.
Here's this kid that, growing up was picking walnuts with his mom and his stepdad to help support his family. And now I was bringing senior USDA officials to the Central Valley to see this is what we deal with.
I really hope that I can return to the federal government someday so I can continue to serve the American people.
Welcome to The Other 80. I'm Claudia Williams. In March, on the heels of what had already been substantial layoffs and resignations, HHS announced it would be cutting another 10,000 jobs. And I've been thinking about how I want to use my voice and this platform to talk about what's happening. I thought about bringing you a monologue from me, but instead, I'm bringing you stories from a few of the people who have already been laid off. They talk about the work they did, why they served, and what impact they had. You'll hear from a former Marine who is improving primary care for veterans in Michigan, a child of farm workers who is expanding economic opportunities for rural communities, a former journalist who is helping the public understand complicated research findings about HIV and AIDS, and a technologist who is improving the organ transplant distribution system. These former federal workers are only a small handful of the thousands of civil servants who left in February. Perhaps some of them have been or will be rehired, but thousands more will be fired. Their stories are so powerful in communicating the impact of these cuts.
My name is Andrew Lennox. I live in Ann Arbor, Michigan. I'm a veteran that just wants to help veterans. I was actually a kindergarten teacher for a short time, and then eventually it led to a 10-year career in the Marine Corps, and then trying to figure out how I can continue serving. It's not just the service of the country, but it's the service of the people. So developing and helping those junior Marines. So I was how do I do that in the civilian world? Ended up with me at the Department of Veterans Affairs Medical Center in Ann Arbor, Michigan. I'll say the second greatest job I've ever had, because the Marine Corps will always be number one, but it's a close second. At the VA, my job was administrative officer for our primary care division. And it was awesome. I never thought, I'd be jazzed to be sitting at a desk or standing, at a desk, but it was great because every day when I walked to that hospital, I'd see, either the veterans that served before me or those that served with me, throughout the hospital. And I would intentionally park on the other side of the hospital so I could walk through and just kind of see everybody every day and remember, this is my foxhole now, this is where I'm going to do my part to serve. It's doctors and treatments and programs and workflows that are all made specifically for the issues that veterans are going through. And that was another really unique thing, and why the VA stuck out to me was because after you're in the military for so long, it's extreme highs and extreme lows, because you have that, that feeling of camaraderie, understanding everybody around you knows what's going on. And then you leave, and instead of having an entire platoon around you, supporting you, your tribe, you're kind of alone. And that's how I felt when I left the Marines. It's hard to turn off after 10 years. And then walking into a VA hospital, suddenly everybody here gets me. My job as administrative officer at the Veterans Affairs Medical Center, I was terminated. Yes. So I was part of 1,000 VA probationary employees that were fired by email 7:30 at night from our chief human capital officer, without the input from our supervisors, the director of our hospital. Not only was I terminated because I said it was poor performance, which I was so new. I was only there for 2 months. I hadn't even had a performance evaluation yet. But my colleagues got the same email. And these were colleagues who had recently been promoted. And because they'd recently been promoted for outstanding performance, they're in the probationary status again. And they were fired for poor performance. In my time at the VA, I've never seen harder workers in my life. Obviously, it's a large institution, which always has flaws, but these are hardworking people. These are not deep state agents. This is not the swamp. These are our neighbors, our family members. These are veterans who chose this job these positions, whether it be the Department of Veterans Affairs, the EPA, HHS, like we chose to do this, not because it's always the highest paying job, but because like we want to continue serving our country and the people around us. And the goal of eliminating all these people at the Department of Veterans Affairs was to better provide for veterans. And then they fired one. Actually, they fired 30% of 1,000 of those employees that week. So the effects of their like arbitrary terminations, there's serious consequences, not just to all the families of the employees terminated, but to the institutions, specifically the Veterans Health Administration. Like the Silicon Valley move fast and break stuff. You can't do that with healthcare because you don't break stuff, you hurt people.
My name is Eileen Wood. I am a former federal employee under HHS, and I worked at the Health Resources and Services Administration as a public health analyst. I have my master's in public health from the University of Maryland. I grew up, born and raised in the DC area, so public health is very important to me. I hope to work in that field throughout my career. I was always kind of torn between public health versus healthcare. And it was when I started working in the ER and with patients that I really got to see the health disparities, the issues with our healthcare system, the barriers to care, how people were using the emergency room as their primary care because they didn't have other options, lack of understanding about where to follow up or how to follow up. And that's when my passion for public health started to grow. When I decided to go get my master's in public health, and just decide, how do I want to serve people? Is that at the bedside, or do I want to try to impact a larger population by working in public health? So I was working in the Bureau of Primary Health Care at HRSA. So that's the health center program. So when you hear federally qualified health centers, that is what our work funded. We serve, I believe, over 32 million Americans last year received healthcare through the health centers, and the care that's given at the health centers is either as good or better healthcare outcomes than private practice. And so we went to a health center in Brooklyn, New York that served a mainly Jewish community, Orthodox Jewish community. And so it was really cool to see how they had overcome barriers to care, how they had understood problems in their community, such as a lot of people still have a lot of stigma about mental health care. And so something that their health center would do would have like a general waiting room. So if someone was there for their primary care doctor versus a mental health visit, it was the same waiting room so that there was no stigma and anyone could get access to care. And so it was really cool to see how they were trying to overcome those barriers, and how each health center seems to really understand their community and the particular needs of the community. I was a probationary employee. My start date was February 25th of 2024. And on Valentine's Day of this year, I got a call from my boss that I was being placed on administrative leave, effective immediately, pending termination March 14th. Unfortunately, the following week, I got an updated termination notice that date was being moved up to February 23rd. And that was so that they could proceed with terminating me before my probationary period was up, because if they kept the original date of March 14th, I wouldn't have been a probationary employee anymore and they couldn't have terminated me. So it was really awful. I was supposed to be promoted on the 25th as well. My letter cited poor performance, the same letter that everyone got. It's really sad and frustrating. Yeah, I wasn't offered any severance pay. So it's just been personally devastating, financially devastating. And I had kind of thought that because this program is bipartisan funded, it has bipartisan support, it helped so many millions of Americans, that we would be a bit more insulated. And we weren't. I just hope that people understand the impact that federal employees have on our country and how much good that they do. I know a lot of people do understand that, but I think a lot of people still don't understand that, and they hear the rhetoric of laziness or inefficiency. And all the people that I worked with, and including myself, were extremely bright people and hardworking and cared so much about the mission of the health center program. And so I really hope that whatever happens next at the health center program will continue to live on because of the amazing impact it has on so many people.
My name is Jesus Murillo. I'm originally from the great state of New Mexico, but I was raised in the San Joaquin Valley in California, specifically in the Visalia, Fresno area. Growing up, I was raised by a single mother. I'm the youngest of five. I'm African American. I'm a Chicano indigenous. And so for me, a lot about who I am and what I do in life and how I've been navigating my career is really directed by my upbringing and who I am. I'm originally from New Mexico, but I was raised in Central California. Growing up in the Central Valley during the time I was there as a child, I grew up in a county that had the second highest teen rate of pregnancy. It was also one of the most illiterate counties in the state at the time. And so for me, I saw firsthand a lot of economic injustices happening to particularly communities of color. I'm talking about, African American, Hispanic, Latino communities. And so figuring out how people that look like me, that come from backgrounds like I do, could, make their American dreams so be, right? And I think for myself, I'm someone that, has seen firsthand how policies have truly devastated communities. And if I even reflect on myself, my parents, my mother, she worked at a J.C. Penney's as a sales associate. And my stepfather, he worked in the fields picking walnuts, working in agriculture. For them, they worked plus 40-hour weeks growing up, but they could never afford anything, right? They worked twice as hard in everything that they did, but they never could afford anything. We were constantly one paycheck away from either going homeless or going hungry. All of that, right, made me very mindful of the fact that what I wanted to do was be of service to my communities that historically and have never received, any opportunity or haven't had a voice speak at the national level. And so then that really pushed me to want to become a presidential management fellow. And I began searching for different institutions that I thought were doing some great work. And at the time, I chose the U.S. Department of Housing and Urban Development, where I became a community planning and development specialist, looking at, how is our nation's premier institution on housing and economic development really addressing some of these issues that people of color, people of underserved communities, and I'm talking about the poor Appalachia white communities as well, right? I think oftentimes when we talk about underserved communities, oftentimes it's associated with brown communities, but for me, and I think the way that we holistically address some of these larger issues is by looking at all communities that have need, and so I think for the past year and a half or year and 5 months, really, I've had the incredible opportunity, and essentially it was my dream job, right, to serve at the highest level in U.S. federal government. During that time at HUD, part of the work that we did there was bring technical assistance to one of the local towns that could help build the capacity and regional awareness. What federal resources are available? We were continuing to do that in other parts of the country, but I think for me, being able to be a part of the team that was bringing some of that change to those local communities was something that I found to be extremely fulfilling and in many ways a complete circle. As a part of the PMF program, we're giving 6-month rotation opportunities, and we can pick any other agency. And for me, because I grew up in an agricultural rich community such as California, the Central Valley, I was like, you know what? I want to work on farm workers. My stepfather, he's a farm worker. I was raised by farm workers. And in many ways, farm workers or agricultural labor is the backbone of our food security in the United States, right? And part of the work that I did there was create an opportunity to bring senior levels of USDA to the Central Valley. And I think that was another full circle movement, right? Because, here's this kid that, growing up was picking walnuts with his mom and his stepdad to help support his family. And now I was bringing senior USDA officials to the Central Valley to see this is what we deal with, right? These are the realities that our country faces. This is the reality that the people that are literally bringing food from the soil and bring it to the table, right? They themselves don't even have the funds to oftentimes feed themselves as such, right? I myself was terminated on February 14th of this year at approximately 3:53 p.m. And that date, and that time will always live with me because I remember up until the very end, even though my boss had called me earlier in the day and she was on leave, and she was like, I think you're still on that list, unfortunately, as a probationary employee. I just remember feeling so frustrated, not necessarily because I was going to lose my health care or my dental or my vision, but because the work that I was doing, I was working with congressional offices to help support grantees that, had never had federal funding. And this was going to be their opportunity to really serve their communities, right? And I mean, these grants, they covered everything from potholes all the way up to repairing of bridges, over $7 billion worth of funds to over 5,000 grantees. It was going to now go at a much slower rate. And because of that, people and nonprofits and small organizations were going to have to take out more loans, that probably default on existing mortgages. This was the first job that I ever had that had, dental, vision, and healthcare all in one. And so for the first time in my life, being able to say, this is the American dream. I have worked so hard to get to this place. And now some remote robot created this email that is essentially terminating and stripping me from the opportunity to continue to serve the American people.
Next up, Amy Paris talks about her work to improve the organ transplant system. Ashley Hackett shares about her communications work on HIV/AIDS. And Jennifer Robinson tells us about how she was reducing women's suffering from endometriosis.
I've mostly dedicated my life to civil service. I've been a community college teacher. I've been a government contractor and a government employee. I've probably spent a solid 20 years of my life trying to help make people's lives better. And this is the first time that I have been theoretically fired for cause in my entire career. I had gotten my original degree in computer science and thought that that was something that would be a financially rewarding job, but it wasn't a job that rewarded my dreams and my hopes for what could be better in this country. I thought getting into civil service by way of technology would be a good way to use those skills to help people. The government has not had direct oversight of the security of the systems that make sure that people get organs allocated to them on a daily basis. As you're probably aware, there are 17 people in this country dying every single day on the wait list for organ transplantation. And so it was our goal to come in, effectively oversee that system, make sure that it was living up to the standards of the American people, to make it more efficient and effective at allocating organs, and also make sure that it was safe for the patients that use it. We were in the process of negotiating with the company that manages UNET, called UNOS. They've been in charge again for almost 40 years, and they're not used to the idea of oversight. So we were working with them to understand what was going right and going wrong with their system. We were working with that system's users, the hospitals, the transplant centers, the organ procurement organizations, and the patients to understand what they needed from that system. We were trying to get better algorithmic transparency for the American people so that their tax dollars being spent to run this system actually helped them understand where their organs were coming from and how they were being allocated fairly. And lastly, we were trying to make sure that the system was safe to use. It's a very old system. It's a system that's running on hardware and software that is reaching its end of life. And we were trying to make sure that that hardware and software would be upgraded and ensure that there would be no, lapses in service that could potentially cost American lives. You can see a punch coming, but it still hurts if it hits you. So I was probably more aware than some people because I was the deputy team lead. I had some access to higher level information about what was going on. But, to get an email at 9:00 on the night of Valentine's Day on a Friday night that says, your services are no longer needed. Oh, and by the way, we're saying it's for performance reasons. We're terminating you with cause, which is just blatantly not factual. I had a 4.75 out of 5 on my last performance review. I've delivered major systems for the American people, like IRS Direct File, improving airport screening algorithms to make lines go faster and to protect our airports and keep them safer. I did work on the first ever X gender marker on US passports. I've worked across 5 presidential administrations, including the last one. I worked during the entire first Trump administration as both a contractor and as a Fed. And I did that job happily because I was serving the American people. That's not what is currently happening in the federal government. This is the very first time that I've ever worked for an administration that seems to be actively trying to undermine democracy and faith in our government and trying to make the government work less well for the American people, less efficiently and less effectively. I've never seen that before.
My name is Ashley Hackett. I am a former communications specialist in the federal government. Up until almost a month ago, I worked for the National Institutes of Health in their Office of AIDS Research. So, as a communications specialist on the team, I did a lot of work translating really complex research findings about HIV and AIDS and all of the co-occurring conditions and translating that for the public. I also worked a lot in communities of people who have HIV or who are supporting, caregivers for people with HIV. And a really important role of our office was to have listening sessions with community members and to find out what they need or what they're looking for from HIV research. And so because the federal government funds the majority of HIV research in America and also a lot of the HIV research around the entire world, it was really important for us to make sure that we were getting accurate information from our communities. I started out my career as a journalist. And so the skills that I picked up interviewing folks, doing investigations, political reporting. I ended my journalism career as a congressional correspondent. So it was sort of a happy marriage of my ability to speak to people from all different walks of life and get the information that we need out of them, and also to be able to translate that to sort of complex policy and science. There's so many instances of the US government not necessarily having the most ethical scientific practices throughout the years. And so for that reason, there's a little bit of lack of trust in science for minorities of any kind. So for my team, it was really important to ensure that the work that we are doing for people who have HIV or people who will get HIV in the future was really centered on what those communities need. And so it was essential for us to listen to these communities. I identify as a queer woman, and so a lot of people that I am in community with have been impacted by HIV in one way or another. And so to me, it was incredibly important to choose a career where I could directly, impact people in my own community. And I had seen for a long time federal government and federal funding and policies and all these things negatively affecting the queer community. When I joined NIH 3 years ago, I felt like there was sort of a snowball effect of some positive changes happening, and I wanted to be a part of that. Our entire office was gathered together for a yearly pre-planned operational planning meeting. So this was about 3 days, I believe, after the January 21st inauguration. And during that day, one of my colleagues who was friends with quite a few other queer or people of color people in the government started getting messages from folks who were in what the administration had called DEI positions, and saying that they had gotten a call either that day or the night before and were immediately put on administrative leave. And for us, working in HIV research, a lot of the messaging that we use is respectful of people's bodies. So we will say men who have sex with men, we'll say transgender people, we'll say breast or chest feeding when referring to, infancy and things like that. So to us, these are really normal terms, but we knew that they were buzzwords for the administration. So we're all sitting here in our group operational planning meeting. And at the end of the day, our director comes up to the front of the room and she tells everyone the administration has directed any DEI language to be scrubbed from public facing websites. And so, of course, there were questions right away. We were like, well, what counts as DEI? What does that mean? Do we have to get rid of the word health equity, which is huge? And we later found out that we did need to scrub words like gay, bisexual, men who have sex with men, transgender. For me, specifically, it was horrible to hear that because my proudest achievement from the past year had been writing some of the clinical guidelines for HIV healthcare for people who are transgender. Because I'm, in the queer community and some people very close to me are transgender, I know how to talk about these things. And sometimes the extremely smart doctors and their clinical wording is not necessarily accurate for the way that people are living in real time. The way that I was fired was receiving a letter that was identical to all other probationary employees at my agency that said I was being let go because of poor performance. Despite there being absolutely no proof of poor performance included in the letter, the lies being spread about people like me and my other colleagues who were fired are really unfortunate to be a part of. I have not been able to confirm that I'll be able to collect unemployment because of the reasoning for my firing. They ask you for, were you fired because of no fault of your own? And my letter says that I was fired because I had poor performance. So I haven't heard back yet if I will even be able to collect unemployment, despite the thing that the administration is framing as a layoff. So I want the public to know that we're not making noise because we're mad we got laid off. We're making noise because hundreds of thousands of federal employees were fired indiscriminately in a way that's not entirely legal.
My name is Jennifer Robinson, and I have about a decade of experience in public health. I have a passion for promoting health and reducing health disparities, particularly among at-risk communities, populations experiencing disparities. And I've just always really wanted to serve the American people, and that is what brought me to the federal government. I actually got terminated about a year and a half into my fellowship, so I had, not that long left. And then as part of that, you also go on a developmental rotation. And so I spent 5 months over at the White House Gender Policy Council, where I worked on the White House Initiative for Women's Health Research, which was a really eye-opening experience, and where I got to work across stakeholders and different agencies beyond NIH even, including VA and DoD and things like that. Well, really, I think, if you've ever dealt with or had someone, who've had any sort of health issue, including cancer, issues with pregnancy, mental health concerns, all of that is being researched through NIH funds or at NIH. And I think that what people may not realize is just the entire infrastructure behind this, behind the development of new diagnostics or treatments for things like cancer, for things like endometriosis, which was one thing I worked on. In terms of impact, for instance, right before I was terminated, I was working with the Gynecologic Health and Disease branch at NICHD, where they really work on trying to find new diagnostics and interventions and treatments for gynecologic conditions like endometriosis. NICHD was one of the leaders of this initiative called Act Endo, which was aimed at trying to find new and non-invasive diagnostics for endometriosis, which is an incredibly debilitating disease. It can cause a lot of pain and suffering, and also can take a long time to get diagnosed. Right now, the main ways to diagnose endometriosis is through surgery. And so, that's one reason why people may not get diagnosed for even up to 10 years. And so this innovative $3 million challenge was really aimed at really catalyzing research in this area to get new types of diagnostics. And so I really want the public to kind of see these sort of innovative ways that NIH is approaching health to improve the health and well-being of the American public. The NIH funded research that I did at the University of Maryland College Park as part of the Community Thrives Lab was working on evaluating an AI chatbot called Rosie the chatbot. And the focus of that study was to really reduce maternal depression as well as increase well child visits. And the way that they are doing that is by creating this AI chatbot that can answer new moms' questions. And the goal of this is to really, and you say like, why can't you just Google that or things like that? But there's a lot of misinformation online, especially targeting, new moms, pregnant women. And so this way you can really get valid sources and be able to have the AI chatbot then respond to their questions. And so that has been going really well, and they've been really engaged with the community. And the focus of that project is also to reduce health disparities because, again, there's a lot of health disparities around maternal mortality and morbidity. And so, for instance, Black women, are 3 times as likely to die around childbirth or for pregnancy-related causes as opposed to white women. And so having new, innovative approaches to maternal mortality and maternal health, like this chatbot or other NIH-funded studies, is so incredibly important to address the maternal mortality crisis that is happening in the United States right now. I really hope that the work that I've done over the past decade of public health has really been focused around catalyzing research and improving the health of women in particular, improving people's awareness of the specific issues that women experience and how that has been ignored for centuries. Women weren't even required to be included in clinical trials until the 90s. But I just really hope that momentum keeps going. And I think it will, even if, there are some more roadblocks now. But I hope that decades from now, I can look back and say, I got to be part of this movement that really made a difference for women. And so I hope that I have been able to help move the needle forward in terms of also addressing health disparities. I think is incredibly important. So I think that those two sides of the coin definitely are really important to me. It was really devastating to not be able to finish my program, especially seeing on my termination letter this issue of performance, when meanwhile I had received the top scores in my performance reviews. I had just gotten a promotion, and I had also been making a lot of life plans thinking that I would be able to convert to a full-time position at my institute when I was done with the program, which is what my specific part of the fellowship did, is that they actually had a spot for you at your institute. So I didn't only miss out on finishing my program, but I also lost out on that position that I thought I was going to have. And so a lot of just life decisions that I was going to make had been really upended. I really hope that I can return to the federal government someday so I can continue to serve the American people.
I don't have much to say here because I want these stories to speak for themselves, but I do want to say this. It can be easy to watch what's happening and feel helpless, but we need to speak up. We need to use our voices and extend our platforms and tell these stories. Hire someone who just lost their job. Call your representative. Write an op-ed. The health of America matters, and our voices do too. This podcast was created by me, Claudia Williams. My podcast producer is Avery Moore-Kloss. There is more information on my background, this podcast, and our guests on our website, www.theother80.com. Head to our website to subscribe to the Other 80 newsletter and follow the Other 80 on our new YouTube channel. Until next time, I'm Claudia Williams.